Hi everyone, this is Glenda Ganzon and welcome to my Human Anatomy and Physiology class. And for today's video, I'm going to discuss the different diseases, disorders, and injuries of the integumentary system. So stay tuned. The integumentary system is susceptible to a variety of diseases, disorders, and injuries. And this range from annoying but relatively benign bacterial or fungal infections that are categorized as disorders, to skin cancer and severe burns, which can be fatal. And in this video, you will learn several of the most common skin conditions. So here are some of the diseases of the integumentary system. One of the most talked about diseases is skin cancer. Cancer is a broad term that describes diseases caused by abnormal cells in the body dividing uncontrollably. Most cancers are identified by the organ or tissue in which the cancer originates, and one common form of cancer is the skin cancer. The degradation of the ozone layer in the atmosphere and the resulting increase in exposure to UV radiation has contributed to its rise. Overexposure to UV radiation damages DNA, which can lead to a formation of cancerous lesions. Although melanin offers some protection against DNA damage from the sun, often it is not enough. So the fact that cancers can also occur on areas of the body that are normally not exposed to the UV radiation of the light or the sunlight suggests that there are additional factors that can lead to cancerous lesions. In general, cancers result from an accumulation of DNA mutations, and these mutations can result in cell populations that do not die when they should, and uncontrolled cell proliferation that leads to tumors. Although many tumors are benign or they are harmless, some produce cells that can mobilize and establish tumors in other organs of the body, and this process is referred to as the metastasis. So cancers are characterized by their ability to metastasize. This is a picture of basal cell carcinoma that can take several different forms. Similar to other forms of skin cancer, it is readily cured if caught early and treated. Basal cell carcinoma is a form of cancer that affects the mitotically active stem cells in the stratum basale of the epidermis. It is also the most common of all cancers that occur anywhere in the country and is frequently found on the head, the neck, arms, and back, which are areas that are most susceptible to long-term sun exposure. Although UV rays are the main culprit, exposure to other agents such as radiation and arsenic can also lead to this type of cancer. And wounds on the skin due to open sores, tattoos, burns, etc. may be predisposing factors as well. So basal cell carcinomas starts in the stratum basale and usually spread along this boundary, and at some point they begin to grow toward the surface and become an uneven patch, bump, growth, or scar on the skin surface. Like most cancer, basal cell carcinoma respond best to treatment when caught early. So treatment options include surgery, freezing or cryosurgery, and topical ointments. Another type of cancer of the integumentary system is the squamous cell carcinoma. Squamous cell carcinoma is a cancer that affects the keratinocytes of the stratum espinosum and presents as lesions commonly found on the scalp, ears, and hands. It is the second most common skin cancer, and they are more aggressive than the basal cell carcinoma, and if not removed, these carcinomas can metastasize or spread out. Surgery and radiation are used to cure squamous cell carcinoma. Another type of cancer of the integumentary system is the melanoma. A melanoma is a cancer characterized by the uncontrolled growth of melanocytes, which is the pigment-producing cells in the epidermis. Typically, melanoma develops a mole. It is the most fatal of all skin cancers, as it is highly metastatic and can be difficult to detect before it has spread to other organs. So melanomas usually appear as asymmetrical brown and black patches with uneven borders and a raised surface. Treatment of this type of cancer is typically involves surgical excision and immunotherapy. Doctors often give their patients the following A, B, C, D mnemonic to help with the diagnosis of early-stage melanoma. And if you observe a mole on your body displaying these signs, consult a doctor. A is for asymmetry. The two sides are not symmetrical. B is for borders and the edges are irregular in shape. C is for color. The color is varied shades of brown or black. D is for diameter and it is larger than 6 mm, and E is evolving or its shape has changed. And some specialists cite the following additional signs for the most serious form nodular melanoma, which is EFG. So E stands for elevated. It is the raise on the skin surface. F is for firm or it feels hard to touch, and the last one is G or growing and it is getting larger. So that is the A, B, C, D, E, E, F, G as a mnemonic for observing the cancer. So let's move on to the skin disorders. There are two common skin disorders. They are eczema and acne. Eczema is an inflammatory condition and occurs in individuals of all ages. Acne, on the other hand, involves the clogging of pores, which can lead to infection and inflammation, and it is often seen in adolescents. Other disorders not discussed here include seborrheic dermatitis on the scalp, psoriasis, also cold sores, impetigo, scabies, hives, and warts. So eczema is an allergic reaction that manifests as dry, itchy patches of skin that resemble to rashes. It may be accompanied by swelling of the skin, flaking, and in severe cases, bleeding. Many who suffer from eczema have antibodies against dust mites in their blood, but the link between eczema and the allergy to dust mites has not been proven, and symptoms are usually managed with moisturizers, corticosteroids or corticosteroid creams, and immunosuppressants. Another skin disorder is the acne. Acne is a skin disturbance that typically occurs on areas of the skin that are rich in sebaceous glands, like the face and back, and it is most common along with the onset of puberty due to associated hormonal changes, but can also occur in infants and continue into adulthood. Hormones such as androgens stimulate the release of sebum. An overproduction of accumulation of sebum along with the keratin can block hair follicles, and this plug is initially white. The sebum, when oxidized by exposure to air, turns black. Acne results from infection by acne-causing bacteria, which is Propionibacterium and Staphylococcus, which can lead to redness and potential scarring due to the natural wound healing process. Now let's move on to the integumentary system injuries. Because the skin is a part of our bodies that meets the world most directly, it is especially vulnerable to injury. So injuries include burns and wounds as well as scars and calluses, and they can be caused by sharp objects, heat, or excessive pressure or friction to the skin. Skin injuries set off a healing process that occurs in several overlapping stages. The first step to repairing damaged skin is the formation of a blood clot that helps stop the flow of blood and scabs over with time. Many different types of cells are involved in wound repair, especially if the surface area that needs repair is extensive. And before the basal stem cells of the stratum basale can recreate the epidermis, fibroblasts mobilize and divide rapidly to repair the damaged tissue by collagen disposition, forming granulation tissue. So blood capillaries follow the fibroblasts and help increase blood circulation and oxygen supply to the area. So immune cells such as macrophages roam the area and engulf any foreign matter to reduce the chance of infection. So one of the injuries of the skin is burns. A burn results when the skin is damaged by intense heat, radiation, electricity, or chemicals. And the damage results in the death of skin cells, which can lead to a massive loss of fluid. Also, dehydration, electrolyte imbalance, and renal and circulatory failure follow, which can be fatal. Burn patients are treated with intravenous fluid to offset dehydration, as well as intravenous nutrients that enable the body to repair tissues and replace lost proteins. Another serious threat to the lives of burn patients is infection. Burn skin is extremely susceptible to bacteria and other pathogens due to the loss of protection by intact layers of skin. And burns are sometimes measured in terms of the size of the total surface area affected, and this is referred to the role of nines, which associates specific anatomical areas with the percentage that is a factor of 9. Burns are also classified by the degree of their severity. So the first degree burn is a superficial burn that affects only the epidermis. Although the skin may be painful and swollen, these burns typically heal on their own within a few days. Mild sunburn fits into the category at the first degree burn. And for the second category, or the second degree burn, goes deeper and affects both the epidermis and a portion of the dermis. So these burns result in swelling and painful blistering of the skin, and it is important to keep the burn site clean and sterile to prevent infection. If this is done, the burn will heal within several weeks. And for the third degree burn, which is fully extends into the epidermis and dermis, destroying the tissue and affecting the nerve endings and sensory function, these are serious burns that may appear white, red, or black, and they require medical attention and will heal slowly without it. And there is also a fourth degree burn, which is even more severe, affecting the underlying muscle and bone. Oddly, third and fourth degree burns are usually not painful because the nerve endings themselves are damaged, and full thickness burns cannot be repaired by the body because the local tissues used to repair the damage and require excision, or what we call as the debridement or amputation in severe cases, followed by grafting of the skin from an unaffected part of the body or from skin grown in tissue culture for grafting purposes. Another skin injuries are scars and calloids. Most cuts or wounds, with the exception of one that only scratch the surface or the epidermis, lead to scar formation. A scar is collagen-rich skin formed after the process of wound healing that offers from normal skin. So scarring occurs in cases in which there is a repair of skin damage, but the skin fails to regenerate the original skin structure. So fibroblasts regenerate scar tissue in the form of collagen, and the bulk of repair is due to the basket weave pattern generated by collagen fibers and does not result in regeneration of the typical cellular structure of the skin. Instead, the tissue is fibrous in nature and does not allow the regeneration of the accessory structures such as hair follicles, sweat glands, or sebaceous gland. Sometimes there is an overproduction of scar tissue because the process of collagen formation does not stop when the wound is healed, and this results in the formation of a raised or hypertrophic scar called a calloid. In contrast, scars that result from acne and chickenpox have a sunken appearance and are called atrophic scars. So scarring of skin after wound healing is a natural process and does not need to be treated further. Application of mineral oil and lotion may reduce the formation of scar tissue. However, modern cosmetic procedures such as dermabrasion, laser treatments, and filler injections have been invented as remedies for severe scarring. And all of these procedures try to reorganize the structure of the epidermis and underlying collagen tissue to make look more natural. Skin and its underlying tissue can also be affected by excessive pressure. One example of this is called as bed sore. So bed sores, also called decubitus ulcers, are caused by constant long-term unrelieved pressure on the certain body parts that are bony, reducing blood flow to the area and leading to necrosis, or what we call as the tissue death. Bed sores are most common in elderly patients who have debilitating conditions that cause them to be immobile. So most hospitals and long-term care facilities have the practice of turning the patients every few hours to prevent the incidence of bed sores. And if left untreated by removal of necrotized tissue, bed sores can be fatal if they become infected. The skin can also be affected by pressure associated with rapid growth. A stretch marks, which results when the dermis is stretched beyond its limits of elasticity as the skin stretches to accommodate the excess pressure. Stretch marks usually accompany rapid weight gain during puberty and pregnancy, and they initially have a reddish hue but lighten over time. Other than for cosmetic reasons, treatment of stretch marks is not required. They occur most commonly over the hips and abdomen. Another skin injury is callus or calluses. So when you wear shoes that do not fit well and are a constant source of abrasion on your toes, you tend to form a callus at the point of contact. And this occurs because the basal stem cells of the stratum basale are triggered to divide more often, increase the thickness of the skin at the point of abrasion to protect the rest of the body from further damage. And this is an example of a minor or local injury, and the skin manages to react and treat the problem independent of the rest of the body. So calluses can also form on your fingers if they are subject to constant mechanical stress, such as long periods of writing, playing string instrument or guitars, or even video games. Also, a corn is a specialized form of callus. Corns form from abrasion of the skin that result from an elliptical type of motion. So this ends my lecture about the different type of diseases, disorders, and injuries of the integumentary system. And if you have any question, please write it in the comment section down below and I'll be glad to answer them all. Once again, I would like to thank you all for watching this video and for listening to my discussion. Until my next video, bye everyone!